Good afternoon, everyone. It's good to see you. I know people are joining kind of slowly, I see. Just give us a minute and we will start. Good to see everybody, or at least your names. All right, let's see. So I am Ellen Hahn. I'm the director of UK Cares. I'm so happy to see all of you here today. Some are members of our center and some are not, but this is the first of its kind global environmental health seminar that UK Cares has sponsored. And so we have gracious co-sponsors, the UK International Center, the Shoulder to Shoulder Global, the Central Appalachian Regional Education and Research Center. So I am so pleased to see everyone. Those of you that have been with us before know that we about monthly, UK Cares, the Center for Appalachian Research and Environmental Sciences, holds these seminars, and we could not be more pleased to welcome Dr. Fernando Ortega. I must say that I am on an NIH review panel today, so I will be hopping off after I introduce Dr. Ortega, and then Dr. Erin Haynes, the Deputy Director of UK Cares, will take over, and you'll be in good hands with question and answer, and feel free to please put your questions in the chat, and I will ask that you mute your line if you're not speaking. So Dr. Fernando Ortega is a researcher and a professor at the Universidad San Francisco de Quito. His areas of interest are community development and health, medical anthropology, and exposure to heavy metals. Dr. Ortega also focuses on tropical diseases, parasitism, and ethnomedicine. Dr. Ortega collaborates on research projects with the School of Medicine and Dentistry. He holds a PhD from Oregon State University in Public, Community, and Global Health, and a master's in Cultural Anthropology from Pontificia Universidad Católica, del Peru. I obviously don't speak Spanish. Dr. Ortega is a valued colleague and a partner of our longstanding Shoulder to Shoulder collaborative here at UK. And so welcome, Dr. Ortega.
Okay, Dr. Hahn, thank you very much for the invitation. I have to thank you and Dr. Hines also for being with us today. And I hope that we are going to collaborate also in the future. And I want to thank Cara for the coordination that we have maintained until this moment. As it was mentioned, we have a long-standing collaboration in topics of health in Ecuador with Hombro a Hombro or Shoulder to Shoulder, that is the same institution in the States and in Ecuador. Thanks to a special invitation from Dr. Claudia Oppenheim, I had the opportunity to visit your campus 12 years ago and maintain conversation with several deans of different schools to close our relationship and the main efforts of providing health to the people. I have to recognize publicly that I have collaborated with several universities from the United States, coming like University of Florida, University of Eastern Tennessee, but particularly the University of Kentucky had a different way of focusing the attention of public health and medicine and nutrition and pharmacy and all these contributions that you provided, not only in one brigade, but in several brigades during the year, but also opening a special clinic in order to maintain the continuity of healthcare to the people in charge. You were in charge during these brigades, but you also had the opportunity to relate with other universities in Ecuador, in the case of San Francisco and UTLA universities, and we are together participating, trying to help some health conditions of people. So I also remember that when I was studying in Oregon, I was creating a club of international health in the West Coast of the States. And at that time, we used to call international health because those were international efforts going overseas. And today we are going to talk about a special topic that is global health. And I have to mention that I have adapted a conference that I prepared for the Global Health Program of the Association of Pacific Rim Universities that I gave this talk a year ago. However, I have updated it for you and for the period of time that we are living right now. So from Quito, the capital of Ecuador, I'm telling you that sure, Ecuador is another part of South America, and it's also divided by the Andes in three special geographical regions, like the coastal region, the Andean region, and the Amazon. So we have different ecological niches in each one of these areas and in the different altitudes. But we also have the territory of Galapagos, and that territory is very special because it also brings to us different conditions, ecological conditions, and types of living in these areas. Well, Ecuador is also divided in several states that we call provinces, 24 provinces, 17 million people, 7% self-identify as indigenous people, another 10% self-identify as Ecuadorian, Afro-Ecuadorians, and the rest is mostly mestizo people. I'm a mestizo person, as we all are in the planet. Because 150,000 years ago, when we migrated from Africa to the rest of the planet, we start breeding ourselves with our species, but with some other species like the Neanderthal people. And sure, this is the reality that we have now. And from the cultural point of view is when we are making this kind of distinctions. So we have 14 different indigenous native cultures and 13 different indigenous endangered languages. Those groups are kind of small groups if compared with Quechua people in Ecuador is called Quichua. Well, today we are going to talk about, or I'm going to try to touch in something like 40 minutes, these 5 topics. Let's start doing some clarification of concepts of global, human being, and health. And then we go into the issues in our current globe, the global health leading institutions, and some sustainable development goals that are some of the goals that some organizations are proposing to us in order to avoid the contradictions that we have in health around the planet, and other factors that are not considered when talking about global health. So starting with the concept of global, we understand that this is involving the entire world. Most of the universities in the United States and now in the planet, we are doing global health, specific programs in order to support and to participate and to collaborate with other countries in the process of returning to health from disease. So we are talking about worldwide. It's like global warming. When we talk about global warming, we are not referring to the changes of the climate in Africa or in Asia or in the Americas. This is global. So this must be the concept that we maintain. And then I was very interested to know what are the constituents of human being. So I consulted the web. That's one of our ways of learning something about the planet and the human being. And this is what I obtained. Almost 99% of human body is made out of oxygen, carbon, hydrogen, nitrogen, calcium, and phosphorus. But I was looking for the definition of constituents of human being, not human body. So human being is kind of complex. And then trying to explain this, I have made this scribble for my students. And then I have explained several aspects of these elements of the constituents of the human body. So we see the red. And the red is the somatic, it's our body, is the biology of our economy that is involved in this aspect. So coronavirus is affecting exactly in this way the biological aspects of our body. However, we also have another component, another constituent, and that is the social constituent. And that starts by the love of our parents, father and mother, and then we are born. And in the womb of the mother, we start our relationship with our mother. And then when we are born, we maintain relationship with our siblings and the family, and probably the community, the neighborhood, and the nation, and the planet. So those are other components that are very important. However, for some of those that believe in spirits, well, this is a spiritual component. This spiritual component is not only this conception of spirit. It's the values, the beliefs, the relationships, values like solidarity, like loyalty, like prevention in your mind. Those are special values that are different in different societies. And then we have a fourth component, fourth constituent, that is the environment. But the environment is not that green aspects or clean water that we see in the physical environment. Those are also the social environment and this spiritual or values environment that is involving our economy. Here in Ecuador, there in the States, or in Russia, or in China, or anywhere where we are as human beings, we have these four constituents. So when we talk about health, health is not only referred to the biological component, it's all of this. So the health concept, now we go to the third concept. Health is not perceived in the same way by all members of a community, including various professional groups like biomedical scientists, social scientists, health administrators, ecologists, politicians. So this is giving rise to confusion about the concept of health. Ecologists view health as a dynamic equilibrium between man and the environment, all these environments, not only the physical environment. Health is related to the human being constituents, so all the constituents that I already mentioned. So then we have a holistic approach that implies all sectors of the society influence in health, like agriculture, food, education, housing, public works, and industry, industry, industry. I mentioned three times, at least three times industry, because that is a special key for health in the planet. And we are going to discuss about that later. We all know the concept of World Health Organization for health, so I'm not going to repeat it. But beyond exposure to a communicable disease, health status of an individual or of a population, because I have this perspective of public health also, is determined by numerous factors like lifestyle, nutrition, cultural norms, humanitarian and other crises, inequalities, that is something very special, national policies and policymakers, broader social, economic and environmental conditions. And these last words are not mine, those are coming from the European Commission. In turn, health of all peoples is fundamental to attainment of peace and security. And that's going to be used by the governments of the planet in order to try to maintain health and try to maintain peace and security. Today we enter into a field that has been discussed for the last 20 years. It's about the determinants of health, social determinants of health particularly. And we can see how these words are coming from the image: social justice, disparity, poverty, ethnicity, race. All these are components, not biological components. Those are the social components or the value components of our way of being as humans. So then let's pass from the conceptual aspects to the global health issues right now that are affecting the planet. I was checking the watch in 2018 and the challenge of refugees and migrants. We can see what's happening in Europe right now, all this movement, all the policy, the American policies about the migrants in the United States, the effects of violence on health, and what about the mental health of people and well-being of that people, and the changing planet that we have. So those are some of the topics. Rapidly, I'm going to touch some of them. And we realize that 1/7 of our planetary population is on the move. They are moving, they are migrating, and they become vulnerable, being displaced and powerless in a foreign land. They face challenges like cultural differences, language, accessing healthcare, and familiarity with local health facilities or services. So then war, genocide, and famine drive people out, and diseases move with the people. So the planet became smaller all the time. I don't know if the younger participants in this talk will recognize this genocide in Rwanda in 1994, and probably the famine in Ethiopia in 1992. But what about the Horn of Africa in 2000? And what about this recent war in Syria that is affecting everybody in the region. It's not only Syria. Well, in Syria, there were 10 attacks to hospitals in a span of 10 days. In Iraq, only 1 out of 10 children are delivered in a health facility because the rest were destroyed. In Venezuela, health facilities have no medicine in the stock. So deliberate, calculated assaults on health facilities kill not only patients, but also health workers. So vulnerable health services are devastated. But what about people's mental health? Our mental health. Trauma due to natural disasters, gun violence, disease, chronic poverty, political unrest, and uncertainty are some of the current stressors that affect our mental and physical health. And sure, pandemic cases like the one that we are living right now. So then we have moved to changing climate in a health issue, as a health issue. You are supporting more and more times hurricanes, tornadoes, in Asia, typhoons, high and low temperature records all over the planet, fires, droughts, and more powerful storms resulting from flooding, damage, and death tolls. Those tolls do not include people who die because they need surgery or dialysis after power went out, or heart attacks or strokes or heat exhaustion. Chaos and destruction are increasing the stress conditions and reducing resistance to common diseases. Extreme weather events are becoming more common, affecting air and water quality and life. We should reinforce our health systems to build resilience. We need to keep providing services in a new stormy world. And then we pass to the third element of this talk, that is global health leading institutions. Sure, until to face all these problems all over the planet, we need some institutions. And in this case, there are many international institutions involved in global health efforts. We have had several conferences, like the APA, for example, the APA conferences in the States are giving us the opportunity to talk about global issues. Some of them have a wide scope of assistance, others are focusing, talking about the international institutions. So others are focusing their work to support specific tasks like extreme global poverty or face emerging pandemic threats. And this is something mentioned before this current pandemic. To assist family planning, maternal and child health, nutrition, health systems, strengthening neglected tropical diseases, HIV, malaria, tuberculosis. Then we have to realize that we have been organized around the planet in an organization that's United Nations. In United Nations is encompassing numerous specialized organizations and agencies, programs and funds and training and research bodies and service providers. There are also numerous subsidiary bodies, including committees, missions, commissions, boards, councils, planets. So we have a long list of institutions part of the United Nations. In one of them, especially in touch with our activities, that is the World Health Organization. It's leading many countries in the world. Probably in the United States, it's not the main institution leading the activities of health. However, we recognize also not only this United Nations organization, but also multilateral health organizations like United Nations, World Health, World Bank, and bilateral development agencies like USAID, for example, in the case of in the United States, SIDA, the organization in Canada for this activity, or JICA in Japan, and all those that are in this list, like the Agence Française de Développement. Non-governmental organizations like Doctors Without Borders, Care International, Peace Corps Volunteers, Oxfam, all of them, and all the universities' efforts trying to help in providing better conditions of living and well-being to the people in the world. So the World Health Organization was established in 1948, is the most visible institution in disaster relief and immunization programs. and has provided us for two opportunities some goals, like the Millennium Development Goals and right now the Sustainable Development Goals. So multilateral, bilateral, and non-governmental organizations, all of them, they are making critical contributions to improve the global health. Then is when I have a question mark. I have a question mark for global health. And from here, this is the monument of the equator line. You see on the right side, the north, left side, the south. So we are facing the east in front of us and the west in back of us. The opposite. And I propose you a reflection on these global health issues, institutions, and sustainable development goals accomplishment. Let's start thinking global. So when I entered the primary school, the first grader, the teacher used to say that the planet was divided into two equal parts. And then with the age and my experiences, I was realizing that that is not exactly true. Probably geographically, there is this equator line. However, the difference between north and south are very big. Where's technology? Where's knowledge? Where's science? Where's richness? Where's poverty? Where's lack of development? So we can see the line moves down and the conditions on the south are different. Which south is not only the geographical south. In each one of our societies, like in the United States or in Ecuador or in Russia or anywhere, we have this division in our society. Those that are wealthy and those that are poor. And the division is also creating some inequalities. So health of the world populations is in a state of inequality. People have the vastly different stories to tell about the health depending on their economic status, level of education, place of residence, sex, age, or gender, and other potential base for discrimination. And this is mentioned by the World Health Organization. The United Nations for 2030 agenda is providing us this idea of sustainable development goals that are indivisible, integrated. So I'm going to touch some of those. Human inequalities have always been present in most societies. Since the very beginning, since 150,000 years ago, these inequalities are part of human being. Surprisingly, today, you and myself, we are interested to understand the reasons of this widely expanded human condition. When talking about strategies to cope with inequalities, we must recognize how difficult it is to reach political consensus and commitment on each one of our countries. Those are at least 5 of the Sustainable Development Goals. They mention 17 and not divisible. However, we have no time and it is already 12:23. So we are going to talk mostly about the first and the number 10, poverty, how to end poverty, how to reduce inequality. So the first one, to end poverty. What is poverty? Probably if you go to the dictionary, we have these 3 acceptions of what is poverty. And probably is the first one that is moving us to make all these actions. The state of being extremely poor, thousands of families are living in abject poverty. And that is what is affecting the planet. Then poverty in South America. Now that we're talking from Ecuador, let's see, all countries are affected by poverty in some extent. During the first decade of 2000, or this century, poverty dropped from 43 to 32%. So the countries are trying to reduce poverty with varying degrees of effort and success. And sure, those are just averages. It's not by each one of the region in each country. So there are some differences inside of each country also. Action is being taken by most countries to improve the life quality of people in housing, schools, hospitals. So each country has its own internal history and problems, different reasons, different factors. I explain the levels of poverty in each country. So this is what is happening in Ecuador, and those are the periods of time that were evaluated. So extreme poverty, that means those that are not able to fulfill their family food needs. This is happening mostly in the Amazon region because it's an isolated region with no roads, only the rivers and the people living really far from the rest of the country. However, when we move into um, from extreme poverty to poverty, the color of the country changes. Those are not able to fulfill their food, lodging, clothing, educational, or recreational needs. All of this is before the condition of pandemic that we have right now. So when we compare, because we are talking about global health, it's not only Ecuadorian health, but it's also our neighbors' health and our neighbors' condition and our neighbors' poverty condition. We can compare Ecuador with Peru and Colombia, and we can see the different levels of poverty. We talk about extreme poverty when you have less than $2 a day to survive per person, or $3.2 or $5.5. Imagine if you have no $5.5 a day to survive. Wow, that's the condition of big portions of the people in the planet. In the case of Ecuador, there's only 23.2% that are surviving. Surviving. It's not living, but surviving with that budget of $5.50. And then if we move to the Asia continent, because this was prepared also to talk with people from China, from Japan, and those are the figures that we can find. And we compare, for example, China, only 0.7 in this case, around here, below $2 a day, 7%. That increases importantly and dramatically to 27% for people living without $6 a day. And what about Japan and Korea? Well, they are living in better conditions than the rest of Asia. Thailand, Malaysia, Indonesia, Singapore, and Brunei. Those in underlying countries, those were participating in the talks that we maintained during last year and this year. So those are several conditions that are different in each one of the regions. And finally, let's compare the United States and Canada with Mexico, your neighbor. So something different is happening in Mexico. And Mexico is doing poorly compared to the rest of the other countries in Latin America. And we move forward, Japan, China, Malaysia, United States, and Ecuador, and those are the comparisons. We can see that China and Ecuador are making some of the same kind of conditions in the poverty below $6. However, there are several differences, very tight conditions in this poverty of $3.2, and then a different condition in extreme poverty. So when talking with the people from China, we realize that the problem of poverty is mostly a rural problem in China. So there is a question. Do you have a better figures about poverty in your own country? That was referred to all countries, but also to United States, because I was consulting information from 2018. How much do you know about your neighboring countries? Do you know about this condition in Mexico or in Central America? Is there a fair trade among countries in the globe? Do we all pay a fair price to those providing us the benefits we are looking for? And we are talking about the local markets in each one of the countries of the world. So interestingly, the World Bank goes beyond the amount of money a person or family earns to expand the definition of poverty. And it's providing four aspects, very interesting aspects. Poverty is hunger, is lack of shelter, is being sick and not being able to see a doctor. Poverty is not having access to school or not knowing how to read. So this is a different dimension of poverty, and that increases the number of poor people around the planet. So those are the 10 hungriest countries. Most of them are located in Africa. Haiti, Afghanistan, and Timor-Leste are not in the same region, but those are the 10 countries. And then we are doing some progress to reduce underweight, but we still need more efforts to fight underweight. However, on the other side, overweighting and obesity are increasing all over the planet. And we can mention also that in Ecuadorian society, we are suffering because of higher percentages of children with the same kind of problem of developed societies. So getting an accurate picture of global homelessness, this is the other condition, it's very difficult. So definition of homelessness vary from country to country. The last time a global survey was attended in the United Nations in 2005, an estimated of 100 million people were homeless worldwide. As many as 1.6 billion people lacked adequate housing. So those migrating and those in non-adequate housing, well, we are talking about 1/3 of the population of the planet. And we're very familiar with these images of shanty towns or favelas in different areas of our country. And the image on the right side shows us a wall that is dividing poverty from richness in the city of Sao Paulo. So environmental conditions affect our health. All Caribbean region has been affected by hurricanes. Yeah, we all know, you and ourselves, we are in middle of this kind of natural disasters. Then the question, is the climate change a natural or man-made modification? For me, it doesn't matter. It is already happening anyway. And if that is not only a natural phenomenon, we are increasing the consequences with our actions. Persisting in our habits is opposed to human health. It is unhealthy. It is our responsibility to reduce the level of contamination we are producing all over the planet. And let's check who are those contaminating the planet. So those are the factors that I mentioned here that are not considering when talking about health, global health. So unrelated global health events. If we are all interested in global health, we should review our development goals and the means of our development goals. So those are the 12 nations with the highest CO2 emissions in the planet. China, States, European Union, India, Russia, Japan. So the industrial component, that's why I stress 3 times an industry, industry, industry. Then China is getting the 29%, 1/3 of the contamination of the world. Then the rest of the world with 19%, the States 16, India 7%, et cetera, et cetera. So developed nations have higher carbon dioxide emission per capita. So the responsibility for contaminating the planet is not only the industrial countries, but the rest of the countries that we are buying your products and the production, and we are requesting more and more that kind of production. The 10 largest mismanaged plastic waste producing countries, 70% of the global problem. And we can see the order of those countries related to plastics. Produces million metric tons of this mismanaged plastic waste every year. China, number 1, Indonesia, Philippines, Vietnam, most of them are in Asia. And then we move to marine plastic debris a year is the same thing, particularly China. And those are the final percentages on the right side. So this is contamination of our planet. This is the contamination of our environment. It's not our environment. It's their planet. We are contaminating their planet, the animals' planet. What is the human behavior? No? So those are my questions to this view of global health. How healthy is that? In 2018, world largest arms exporters. United States in the head, and it's in the head. You see the 10.5 billions compared to 8.39 billion of the rest of the countries that are producing weapons. Those are the largest arm importers. So it's also in Asia, mostly in Asia, Algeria, Egypt, in Africa. The world 10 biggest arm importers in the countries receive arms worth more than 15 billion from overseas. They are investing that amount of money in weapons. So are we defending our health? Are we defending our industry? Are we defending our economy? Are these our sustainable ways for living? So it seems that we have a double philosophy, thinking about global health and thinking about destruction, global destruction. So those are the 10 healthiest countries in the world list of last year. Interesting, 6 countries: Spain, Italy, Ireland, Japan, Switzerland, and Sweden. Most of them are in Europe. And then this was something curious that I found on the web. The least unhealthy, the most unhealthy countries. So there is an organization that is clearly Compare, a company based in the UK that helps to connect patients with health clinics, use data about obesity, alcohol, tobacco consumption from the World Health Organization, from CIA World Facebook, and from the World Lung Association to create a list of unhealthy countries. And we can see the colors in the planet for those unhealthy countries related to this particular 3 mentioned health concerns: obesity, alcohol, and tobacco. So that's a business, joining patients and health clinics, the biggest pharmaceutical markets in the world. We can see the same image repeating 1 and 2 times. In this case, the states, and then the rest of countries that are making less than the states. But well, let's compare the 2 industries, pharmaceutical industry and weapons industry. In this case, the health expenditures, also that's something very important. 17.7% of the gross national product that is invested in health expenditure compared to other countries that are spending less. In the case of Ecuador, we assume that that was at least in documents to say an 8%. However, we know it was less than 4% spent in health activities. In this last chart, and I'm going ready to finish with my talk, are we attacking diseases or defending health? Let's see. If we compare in the first country, the United States, the total population of the United States for last year, 330 million people. The health expenditure per capita, $9,500. The health expenditures in total, this is the amount by multiplying these 2 first columns, and then the military expenditures. And when we create a ratio between those 2 expenditures, in the States, you are expending 206 more in military expenditures than in health. In China, 419. In Japan, 99. And then Malaysia and Ecuador, it's just for a point of comparison. So what are we defending? Health or other issues? So global health is imperial. Heart disease, stroke, blood hypertension, diabetes, and injuries are growing everywhere. And the rate of deaths from this uncommunicable diseases or causes is growing as well. Are we focused on our bodies? What about our mind? What about our spirit? And I repeat the scribble here to see that the pharmaceutical industry is just focusing the body. Probably something about mental health also, but this is what is happening in our planet. So let's rethink our global behavior. What a time to be alive, to use a mask. Science is like magic, but real. So among the course learning objectives, the number one and the number 11 in the case of these Pacific Ring universities was emotional intelligence. So I use this definition of emotional intelligence or the ability to understand, use, and manage our own emotions in a positive way. So my advice is to please manage your emotions in a different way than those very emotional global leaders whose behavior is not too intelligent. Let's manage our personal stress, communicate effectively, empathize with others, overcome challenges, and diffuse conflict. And that's all what I have for you today. So this is a reflection about what we mean by global health and what are the behaviors that we are having in our own countries related to this global concern. Thank you so much for your attention.
That's wonderful. Thank you. Thank you so much, Dr. Ortega. You gave us just a huge worldview vision of global health and the intersection between environmental health. How would you, I'm looking also, I love the audience to be able to ask questions at this point. So audience members, if you'd like to ask one, be sure to put it in the Q&A or in the chat section. I'd like to hear your thoughts on COVID-19, what we're struggling with as a global health experience. How would you like to frame COVID-19 and for the future?
Yeah, thank you very much, because this is a big concern we have all over, and we have been working since it started in China. And I have to mention that we were in expectation. We didn't know anything about coronavirus 2. Probably the microbiologists, the geneticists knew something about the coronavirus family. However, the behavior of this special virus was not well known, and that took us by surprise all over the planet. But that's not a good excuse after 8 months to continue having a chaos. So we had to propose to the population a special behavior. And I remember I joined with my friends from Iowa, Iowa University, from Victoria in Canada, and from Beirut in Lebanon, and from Bangladesh in Dhaka. And 5 professors from all these countries, we wrote an article telling the world, hey, look, we are talking about cases of contaminated people, cases of dying people, cases of hospitalized people, but we were not talking about the person involved in this disease. So we needed to talk about the social determinants of health that are the basis of the affected population and the way that the population was going to be affected around the planet. So we already advertise in several journals the possibility of making a change, of focusing the problem not only to the biological components, but also to the population. And then we had the opportunity to create several focus groups in the Society of Quito, and I have been visiting neighborhoods in Quito, but also talking to the families of those patients in the intensive care units of hospitals in Quito, are learning from them what is the point of view of the population. Are they concerned? Are they fear? about the disease. And sure, we maintain connection also with indigenous people in the communities in the Andes, particularly and mostly in the Andes. We also learned at the university that several groups in the jungle were affected, in the Amazon jungle. And they were seriously affected because the prevalence of the disease was very high. However, the mortality is not that high. We learned from the indigenous people that they were using their medicinal plants, the traditional medicine, as we didn't have any medication in the Western world, in the scientific medicine. So they were prepared to face the symptoms of the disease, not to kill the coronavirus, but they were prepared with several medicines. So the pandemic arrived middle of a research project where we were working with some communities, and they provide us the names of 37 plants for breathing problems, so for respiratory concerns. And 4 out of these 37 plants were already tested in Louvain in Belgium for antiviral effects. So interestingly, to join the traditional medicine of some indigenous people from the Andes with the possibility of not necessarily curing, but for reducing the effects of the pandemic in themselves. So 2 nights ago, I was talking to people in Wangahe. Tom Young, that is also present, he knows Wangahe very well. He knows the people in Wangahe. And they told me, we are suffering in several families the cases of COVID. However, we are not dying. We are using other medicines in these communities. A moment ago, I was talking to a researcher in middle of the jungle, and he told me, I need an anthropologist to go and study leishmaniasis in this area. And then I said, how are you protecting yourselves against the coronavirus? I said, well, that was coronavirus here in the jungle. There's no anymore because most of the people in the community suffer the disease, but not dying. So they already are not wearing masks. They are working in a jungle in their own communities. They know each other. So that's not a big concern. Probably the concern is going to be for the anthropologist entering into the communities if he didn't suffer the disease and he has no antibodies. So those are different positions of the people. I'm talking about the reality here in Ecuador, but the reality is also an expectation for vaccine. We are very curious about what is happening with the vaccines, the quality of vaccines, if the vaccines are really tested and how well tested are the vaccines in order to start thinking about the distribution of vaccines. As this is going to be a special resource from the ethical point of view, we need to know which are the groups of the society that are going to receive the vaccine ahead. And we have different groups of discussion with the municipality of Quito, for example, with the participation of different institutions. And we are already starting to talk about this possibility of the distribution of vaccines in order to reduce the problem, the spread of the disease in the Ecuadorian society. I think the behavior in Europe, in each one of the countries, and the first and second waves of these outbreaks is also teaching us if the behavior, the social behavior is enough, if we are obedient, if we are not arrogant. That's going to be very important, the behavior of the society. We advise 3 elements: the mask, the distancing, the social distancing, and washing hands more frequently. At least those 3 aspects. The universities, most of the Ecuadorian universities are closed. We are using the virtual communication with the students, and probably at that level is easier. Not necessarily the same facility is happening, no, not facility, but the same kind of connectivity for families, for poor families, for kids, and for young students in high schools. When you have no computers, Ecuador is not fabricating computers. So those are some of my ideas, that we should import parts of laptops and develop cheaper laptops for everybody in the country. So you see the idea of technology also helping us to avoid contacts. So those are some thoughts about the affection of Ecuadorians by coronavirus.
Those are excellent thoughts. Sedaway, yes, do you have a question?
Yeah, yes, I do have a question. So, very good talk. As you know, we just had a big presidential election, and there's a lot about democratic socialism versus, not. And I was just wondering, uh, is there a political system that evidence shows is more holistic as far as health from one, capitalism versus socialism or anything?
Yeah, probably is the respect that we have to the policies in each one of the countries, and the way you conduct policies in each one of the countries that is uh, creating some anxiety in our case. At least I can talk from the point of view of academy, and we follow every night different channels of TV, American channels here in Ecuador, and we are following first the process of election and also the social behavior of the American society. And we are astonished because of that behavior. Sure, when you have values like freedom, you can interpret freedom in different ways, but it's freedom to be contaminated or freedom to contaminate others. So this kind of prevention, the value of prevention is also important, and that's why I stressed in this opportunity, because right now you have a conflict between two different theories: wearing mask or not wearing mask, Biden or Trump, or something like that. And that is conducting to a chaos of behavior among the population. If those are following political instructions, those are not exactly the scientific instructions, well, that is when the society becomes into a problem. And your example, the example of the United States, is also affecting the rest of countries in the world. So for many times, we have used the CDC as a light that enlighten all of us in order to proceed in epidemiological concerns like in this case. And if the institution is affected from a political point of view, well, that is very sad for us. We follow the instructions of the World Health Organization, but also we take into account all the scientific experience of the CDC and all the organizations the United States has, and you are sharing that kind of knowledge and guidelines to the rest of the world. So you talk, your question is very, very special, very difficult to answer, because it has this commitment, or this connection with the political commitment, which is the line that we have to follow. And I will say, I will go for science, as I mentioned with the two masks. The science is kind of magic, but it's real. So
Okay, but there's no political system that does better with holistic health, like capitalism versus socialism versus communism. They're all pretty much equally bad, or?
yeah, I don't know if you have read, there is an article that was published recently making the relationship in between our human behavior and the use of the planet, the ground of the planet, and the closest relation that we maintain with certain animals, like in this kind of problem with pangolins and bats. In the use of the Amazon jungle, for example, that we are entering more and more inside of the jungle and making contact with other species that probably they were suffering special diseases, or they were the reservoir for different vector diseases. Those were the vectors of diseases, and we are entering to that contact. The problem is that it's another problem. We are too many in the planet. We should start rethinking this idea of family planning. How are we behaving as human beings, populating the planet, overpopulating the planet, looking for more resources in order to maintain our population? Probably we had to refrain some of these ideas of reproduction and to rethink about the number of biological reproduction of father and mother and no more than two siblings. But this is also related to policies. And depending on the region of the planet, in Europe, you need some more population. In Africa and Latin America and in Asia, we have an extra population that we can offer for migrating and these migrating conditions. So from the holistical point of view, also, we have a conflict, a very complex conflict in the planet. And it's not my problem, it's not your problem, it's the problem of all of us. And we need to understand that our behavior, my personal behavior, can affect others.
So Dr. Ortega, I want to thank you again for this awesome seminar that you gave us. You gave us a broad view of global health, but then also showing how local and then that environmental health is at our local level. And that local level can affect the global, as we see through COVID. What we do locally affects the world. So I really appreciate your insights and also showing how much we're connected. And I think in the future, we'll have lots of ways to collaborate with you. So I hope this is not your last visit to the University of Kentucky. We hope to keep you on and engaged with us in the future. So thank you so much
for this opportunity.
Absolutely. Thank you so much for a wonderful talk.
I will be all the time in contact with you for sure. And yeah. I hope soon we can return to our normal activities of these brigades. Yeah. And collaborate with the people that we have been collaborating through the two organizations, shoulder to shoulder, hombro a hombro. Thank you so much.
Thank you. And everyone on the line, please do fill out an evaluation. We'd love to have feedback on how we're doing with our seminar series. Thank you.
Goodbye. Thank you so much.